Surgery works for some, but it is not for everybody, and it is generally an option of last resort. There are a range of medical reasons not to be getting this type of surgery that you'll learn from, as your doctor will explain, as no surgery is without risks. All surgery carries the potential for complications like mild to severe infections, scars, bleeding, and complications related to the anaesthetic. To date, the long-term safety of lap banding and the Roux-en-Y bypass has been documented. However, evidence on long-term safety is lacking for the sleeve gastrectomy option. Each procedure has its own advantages and disadvantages. When we look at the data in general for these three procedures, we see some common threads for risks and benefits. For all risks, it changes depending on the surgeon, so you'll have to ask them for their specific records and numbers. However, when it comes to risks, we can look at those occurring in less than 30 days and those that occur over 30 days, and here are some of the general principles. Looking at a few different studies, we can see data involving over 60,000 bariatric patients. The risk of death within 30 days following the operation averages at about 0.13 to 0.3%. So that's approximately 1 in 3 out of 1,000 patients. And about 4 in 100 have at least one major side effect. Often the ones who are sickest before the operation are the highest risk for having problems during or after the operation. For risks over 30 days, this is surprisingly hard to find, and the exact rates depend on the complication. The most common complications long-term are deficiencies in vitamins and minerals by reducing nutrient intake or by causing reduced absorption from the intestine. These occur in up to 78% of people for vitamin D, 40% for other minerals like zinc and iron. Other common complications include reflux in about 1 in 4 people, hernias in about 1 in 5 people, and issues like diarrhea, constipation, and food intolerances. So it's crucial that these are discussed in detail with your doctor. However, the benefits are quite significant and pretty impressive. Depending on the specific type of surgery, the weight loss could be around 50 to 60% of your excess body weight for 85% of people having it after 2 years. That means 15% will not achieve this but will still have some degree of weight loss. Now note this is excess weight loss, not total. So let's say your weight is 120 kilos or 260 pounds and your healthy weight is 70 kilos or about 150 pounds. Hence your 50 kilos or 110 pounds of excess body weight. So if you lose 60% of that excess body weight, that's about 30 kilos or 70 pounds. And that will take you down to 90 kilos or 190 pounds. A lot of numbers there, I hope that makes sense. The American Society for Metabolic and Bariatric Surgery also report that cancer mortality is reduced by 60%. Death in association with diabetes is reduced by more than 90%, and that from heart disease by more than 50%. It's uncertain whether any given bariatric procedure is more effective than another in controlling these comorbidities, but there are some major benefits. What about long-term weight loss benefits, and are there any failure rates? There have been some concerns reported by major journals like the Cochrane Review, which is a very reputable journal, about the limited high-quality evidence supporting its use and the lack of long-term data. So the exact failure rate is actually quite hard to find. Those studies suggest that 4 in 10 people who've had the operation failed to lose 50% of their excess body weight after 5 years. So that means 6 in 10 will maintain that 50% weight loss, the other 4 in 10 some degree of weight loss, but not that much.